So fibromyalgia is a very painful neurological condition where a change has occurred in the central nervous system, causing an overexcitable pain signaling in the brain and spinal cord. It can often be described as a fire alarm going off when there's no fire. So whilst the brain is continuously sending messages to joints and other extremities and parts of the body, saying that there is pain happening there, there is no inflammation or other typical underlying cause for that kind of pain other than this over signaling going on throughout the central nervous system. It's a very difficult condition to live with for a number of reasons, but there is no confirmed individual cause of fibromyalgia, but in many cases patients who live with the condition appear to have very low levels of certain hormones in their body that are key in regulating sleep, appetite, mood and pain signaling, such as dopamine, noradrenaline, serotonin. There is some research that suggests that increased and sustained levels of cortisol in the body can contribute to fibromyalgia, as the condition appears to develop following significant emotional or physically stressful events like surgery or losing loved ones. A lot of the treatment around or traditionally offered for fibromyalgia tends to be things like CBT and talking therapy and antidepressants alongside other painkillers from the opioid family. So symptoms that can be associated with fibromyalgia can include this increased sensitivity to pain, fatigue, muscle stiffness, difficulty sleeping, problems with memory and concentration that often patients who live with the condition can describe as like a brain fog, like really difficult to concentrate on what you're doing and do it effectively. And in other symptoms can include headaches and sort of gastrointestinal symptoms. Patients often describe the pain as like, when you say, "Where is your pain?" they'll say it's all over, and it's just this constant ache. Sometimes they'll particularly mention different joints or different particular aches, and they'll often talk about not being able to find a position that's comfortable or pain-free for any particular length of time. And I think that people underestimate how much of an impact that constant management of pain has on people's mental health and vice versa. The condition has a significant impact on a person's quality of life, whether it's the low energy levels, and they're all the symptoms are feeding each other. So the low energy levels can be impacted by the constant stress, hormones being released by the pain signaling. Poor sleep means that your body can't recover enough, so that the next day that you are hypersensitive even further to this pain sensations. And this brain fog also resulting from poor sleep and stress hormones. I can find it difficult to socialise for any length of time, to play with your children, to have a full-time job, and just it can be debilitating in lots of ways. However, if it's managed effectively, like any condition, you can plan your day better. It should allow you to set goals for your day and allow you to engage in the things that really matter to you. So anyone can develop fibromyalgia. There is no specifically more high risk group than others, although evidence suggests that there is about 7 times more frequently discovered in women than men. The condition typically develops between the ages of 30 and 40 years old, but this condition can be developed at any time throughout your life. It's estimated that around 1 in 20 people in the UK are living with fibromyalgia, but it's a typically very difficult condition to diagnose clinically. There is not a formal test for it, and it consists of a group of symptoms that are similar to a number of that are typical of other different conditions that clinicians will tend to reach for first. It's estimated that a patient may see 5 or 6 different specialists in a single year and undergo any number of examinations before the condition is correctly identified. So fibromyalgia is a condition that is typically very difficult to manage with more commonly available medications. Often treatment options can include CBT, antidepressants, physio, talking therapy, and commonly opioids to manage the pain. I don't think any clinician in whatever capacity is keen on opioid prescription on a regular basis, especially at some of the doses that a lot of fibromyalgia patients seem to require. And lots of patients find relief from pain and related symptoms from cannabis medicines, and they seem to be particularly effective in aiding patients to reduce the amount of opioids they're on due to the capacity it has to amplify the exposure of opioids in the body. And this sort of multi-symptom management property that it provides is very unique to cannabis medicines and to for cannabis specialist doctors to manage, I think, because it's quite an unusual approach, different to what I think most of us have been used to in our training, which is very targeted symptom management. And I think cannabis is one of those medicines that seems particularly applicable in pain, because pain can be exacerbated or increased or decreased by a multitude of symptoms that are going on in the whole life of a patient. I think there is significant evidence that THC, for example, in particular, can provide some benefits in the management of sleep, pain management, mood elevation, and increased energy levels, the ability to focus on what you're doing for a longer period of time. And ultimately, these are the things that will allow you to have an improved quality of life. So cannabis medicines are an option available to patients with fibromyalgia and for doctors who wish to prescribe for.